What's up, savvy expats? If you're planning on moving or retiring in the Philippines, it is pertinent that you understand how the healthcare system works here. Be it whether you'll need health insurance, what health insurance actually suits you as an expat, and even the cost of healthcare and insurance in the Philippines. These are the non-negotiable things that you should read up on before coming here long term. That being said, in today's video, we'll be covering the basics of healthcare in the Philippines. So without wasting time, let's get on to our first question to ask ourselves before moving here. And that is, how does the healthcare system in the Philippines work? Essentially, the healthcare system in this country comprises of two sectors, which is the private sector and the public sector. The public sector, which is most often found in the provinces of the Philippines, is universal for all Filipino citizens. As a matter of fact, the Philippines was the first Asian country to pass the Universal Healthcare Act in 2019. So, all Filipino citizens are entitled to free healthcare. In addition to that, all expats that are working in the Philippines must apply with PhilHealth. But despite having achieved universal healthcare, the public healthcare system in the Philippines still faces its limitations. First off, as you would probably expect from a government-ran operation, the hospitals are often understaffed, there's a lack of state-of-the-art equipment, and the facilities could also be very old and out of date. That said, most of you expats are likely going to opt for a private hospital. What this means for you is accessibility to specialized treatments, state-of-the-art facilities, international standard doctors, and an overall well-equipped hospital. Now, while private hospitals are considered to be expensive by most locals, for the average expat, it's actually pretty affordable. But you're not going to find a private hospital in your run-of-the-mill town in the middle of the province. Private hospitals are mostly found within the major cities of the Philippines. And so it's no wonder why you'll find the most common expat destinations to be Manila, Cebu City, and Davao. My tip for you, take the route of private hospitals in the Philippines and live in or at least near the major cities of the Philippines. Some of the examples I have for the best hospitals in the Philippines is St. Luke's Medical Center in BGC, Makati Medical Center in Makati, Changhua Hospital in Cebu, and Cebu Doctors University Hospital. These are just a few to name, but there are plenty more. Lastly, it's noteworthy to say that 30% of the Philippine population uses private healthcare as a means of their health in the Philippines. So to summarize, public healthcare is government-ran and insured by PhilHealth, while private healthcare, although it's more expensive, it provides better treatment because it's funded by those who can afford it. Now, moving on to our next question to address, do expats need health insurance in the Philippines? Short answer, yes. All expats who are legal residents of the Philippines must sign up for public insurance with PhilHealth, a government-operated health insurance company. By law, this is a mandatory requirement. And so, to register with PhilHealth insurance, you can do this at any of the PhilHealth offices in your area or just online on their website. But now, this leads me to a very important question. How do you actually obtain health insurance in the Philippines as an expat? Well, first, you must decide on which type of health insurance you want to go for. If you're signing up with public health insurance, then you'll have to register with PhilHealth. If, on the other hand, you've chosen to opt for private health insurance, you'll of course have to purchase private health insurance for expats. But let's say that you're in the category of an expat applying for public health insurance. How would you go about doing this? As I mentioned earlier, public health insurance is administered by the Philippine Health Insurance Corporation, also called PhilHealth. All expats who plan on living in the Philippines longer than 6 months must register with PhilHealth if they're opting for public health insurance. And so those who are employed in the Philippines for work are usually already automatically signed up by their employer. While those who are coming here on different visas, for example an SRRV visa, they'll have to register by themselves. The difference between the two is that for employed expats, their employers will pay the social contributions by themselves, meaning that the employer pays a percentage of the contribution while you also get a portion of your salary taken out as well. If you're not working in the Philippines but you're staying here longer than 6 months, then in that case you would have to do a voluntary registration with PhilHealth. Now that we got that covered, let's talk about how to register voluntarily for PhilHealth as an expat. So the first step to do this is to first check your eligibility to be insured by PhilHealth. Only expats who have a long-term visa here in the Philippines, like for example an SRRV visa, are eligible to be insured by PhilHealth. The second step is to prepare your documents. To complete the registration process, you must fill out a PhilHealth registration form, a copy of your ID, a copy of your passport, proof of residency, and proof you hold a visa in the Philippines. Third, you're going to want to submit your application to any of the local PhilHealth offices within your area. Once you get to step 4, it's time for you to pay your contributions. Since you're registering on your own behalf, you must pay the required contributions to be a member of PhilHealth. These contributions are calculated based on your income. And once all of these steps are completed, the fifth and last step is to receive your PhilHealth ID. This ID will show your right to enroll in the Philippine health insurance scheme and to also receive care. Alright, by now we have a basic understanding of the public healthcare system and how to be insured by a public health insurance company. But let's say you want to go the private health insurance route. I can completely understand if you feel like you're in better hands to enroll in private healthcare to afford you better quality treatment. After all, this does mean you get less waiting time, you get world-class treatment, and state-of-the-art medical equipment at your disposal. So if you're choosing to go with a private insurance, you have two options. Number 1, you can purchase from an international insurance company. Expat insurance companies are designed to offer insurance policies specifically to expatriates, which this makes it easier for you to find a provider with your suited policies. You can usually purchase this insurance online or via the phone. And one of the significant benefits of international expat insurance is that it provides you insurance not just in the Philippines, but around the world and outside the country. And the second route you may take is to purchase insurance policies from a local healthcare insurance company in the Philippines. You as an expat have the option to purchase a policy from a local private insurance company in the Philippines. Usually for this kind of insurance, you must buy this policy after entering the Philippines, and the only thing is that it's only limited to this country. And that brings me to my next question. How much does health insurance cost in the Philippines? Well, let's start with the public health insurance. What you pay for your contributions to public health insurance is directly correlated to your income. So if you make up to 10,000 pesos per month, or around $200 per month, then you're gonna pay 450 pesos per month, or in dollars, $8 per month. Meanwhile, if you're making 89,000 pesos per month, or roughly $1,780 per month, then you'll have to contribute 4,050 pesos, or roughly $81 per month. Assuming that most of you are making a little bit more than this, let's say that your income is around 90,000 pesos, or $1,800 per month and above. Then in this case, you'd have to pay at most 4,050 pesos or $81 per month. However, on the other side of the coin, private health insurance costs will vary depending on your age, your chosen provider, your coverage area, and your coverage validity period. As an expat in the Philippines, expect to pay around $100 up to $300 per month for private health insurance here. Lastly, let's briefly cover specific health insurance companies for expats in the Philippines. The best and most trusted companies to go with here is AXA Philippines, Aetna, Cigna Global, and Pacific Cross. And if you want specific coverage on each of these individual private health insurance companies, their packages, prices, and what they have to offer, I'll link a video in the description I made on the past on this topic. But all in all, those are some of the best international health insurance companies that you can opt for, not just here in the Philippines, but any other country you go to. And as we close, the local private health insurance companies that you may opt for is PhilCare as well as Medicard Philippines. And so there you have it, savvy expats. That is a basic rundown on how healthcare and health insurance in the Philippines works, along with their prices. If you want me to cover specific questions that you have, then just leave your questions down in the comments down below, and I'll be sure to address it and perhaps even make a video on it. And so thank you for watching, savvy expats. It's been a pleasure, and I'll see you in the next video. God bless.